Uncovering the truth about pregnancy is like unraveling a captivating mystery. And amidst the wealth of information, myths often lurk. In this eye-opening video, we debunk 6 common pregnancy myths that have long perplexed expecting parents, from bizarre cravings to predicting the baby's gender. Join us as we untangle the web of misinformation, providing clarity and empowering you with the knowledge needed for a healthier and happier pregnancy journey. Let's embark on this myth-busting adventure together. Myth number 1. You can't exercise. Exercise is good for you in pregnancy and is not dangerous for your baby. As long as there are no complications, you should be able to continue with most exercises you did before getting pregnant. You may need to slow down as your pregnancy progresses, or if your maternity team advises you to. There are also a few exercises to avoid in pregnancy. If you were not very active before you became pregnant, start with gentle exercise, such as walking. You can also try this introduction to pregnancy yoga. Yoga has been shown to help you with your physical and mental health during pregnancy and through birth. Find out more about exercise in pregnancy. Myth number 2. You can't dye your hair. Research, though limited, shows it's safe to color your hair in pregnancy. The chemicals in hair dye are not highly toxic. Some studies have found that very high doses of chemicals in hair dyes may cause harm, but the amount you may be exposed to when coloring your hair is very low. You should always carry out a patch test before using a permanent or semi-permanent hair dye, even if you're using a regular brand. Ask your hairdresser to do a patch test if you're in a salon. Read more about hair dye in pregnancy. Myth 3. You should eat for 2. Needing to eat for 2 during pregnancy is a myth. Your body doesn't need any extra calories until the 3rd trimester, when you may need about 200 more per day. Have a look at what 200 calories looks like. It's important to listen to your body and try to eat a healthy, balanced diet during pregnancy. Try not to put too much focus on counting calories. Just know that your baby doesn't need you to eat lots more to give them all they need to grow. Take a look at our 10 snacks for added energy during pregnancy. Myth number 4. No flying in an airplane. Flying isn't harmful to you or your baby, but you should talk to your midwife or doctor about any health issues, complications, or concerns you have before booking anything. After week 28 of pregnancy, the airline may want a letter from your midwife or doctor confirming your due date and that you aren't at risk of complications. Check your airline's policy online before you book anything. It's also a good idea to make sure that your travel insurance covers you in pregnancy and that you take your medical notes with you. Myth number 5. No sex while pregnant. It's safe to have sex when you're pregnant unless your doctor or midwife has told you not to. For example, if you've had bleeding, have a low-lying placenta, or cervical weakness, you may be advised to avoid having sex until after having your baby. It's normal for your sex drive to change in pregnancy. Some enjoy sex during pregnancy and others don't. Later in pregnancy, an orgasm or sex itself can sometimes trigger Braxton Hicks contractions. This is normal, but don't hesitate to talk to your midwife if you have any concerns. If you or your sexual partner are having sex with other people during your pregnancy, it's important to use a barrier form of contraception, such as a condom, to protect you and your baby from sexually transmitted infections, STIs. Myth number 6. You can't touch cats. Some people worry that cats can give them an infection called toxoplasmosis, which can be dangerous during pregnancy. But stroking a cat or having a cat as a pet puts you at no greater risk of catching an infection called toxoplasmosis. However, you can catch toxoplasmosis from the poo of infected cats. So try to avoid changing the litter box by yourself or use gloves if you do. Touching contaminated cat poo, for example, by changing the litter box and then touching food, can put you at risk. There are lots of things you can do to prevent toxoplasmosis and other infections in pregnancy.